Hi everybody, Dr. Allis here. In this short video, we're going to review some of the basic anatomy of the heart, both on the outside and inside. Let's start with a quick general reminder about this organ that is the heart. When we talk about the heart, we could say, big picture, that this is an organ that's found in the thoracic cavity. Remember that the thoracic cavity was rather large. It included the heart, it included the lungs that are missing here. So to be more specific than just the thoracic cavity, we have a name of the area that the heart and some of its surrounding tissue is in, and we call that the mediastinum. So the very middle of the thoracic cavity, the mediastinum, this is where we find the heart. The heart is not in the very center of your chest. It's actually a little bit left shifted, which is why when we say things like the Pledge of Allegiance, we put our right hand over our heart because it's farther toward the left side of the body. On either side of the heart, we would find the lungs. With the heart being a little bit left shifted, we'll talk more later about how your left lung actually has one less lobe in it. There's not as much space for the lungs on that side. When we talk about the heart and when we consider its function, big picture, its function is to be that pump to get the blood through the body. So we send blood into the heart, get it oxygenated in the lungs, and then send it to the rest of the body. For the heart to be able to be this functional pump, we have to make it out of muscle tissue. And remember that the specific kind of muscle tissue in the heart is called cardiac muscle tissue. To keep the heart safe, we actually have several different layers to it, including a connective tissue layer all the way on the outside called the pericardium. This beginning part, peri, right here, means around. So the pericardium, wrapping around a tough layer of connective tissue that helps to hold the heart in place, and its location is right on top of that diaphragm. So some basic anatomy as we consider the heart. If we look inside of the heart is actually made out of several different layers of tissue. So we talked about that pericardium, that very outer layer that we see out here, but so let's look more here at the internal layers of the heart. So the first layer I want to mention is actually the middle layer. The middle layer of the heart is known as the myocardium. So the myocardium, this myo part means muscle. This is the thick muscle layer inside the heart. If you notice this image I included up here, the muscles of the heart are not just arranged in straight lines like we saw with skeletal muscle tissue. With cardiac muscle tissue, they're arranged in such a way that when these muscles contract, they're going to squeeze the chambers they're inside of to help with the movement of blood. So the middle layer of the heart, our contractile layer, the myocardium. If we go to the very inside of the heart, we see a layer of connective tissue called endocardium. Endocardium is a kind of tissue that's there to reduce friction. Blood is constantly moving in and out of the heart rapidly, so having this smooth connective tissue layer helps to prevent that friction, helps it to be more efficient at its job. And we actually see a similar layer on the outside. So that similar layer that we see on the outside is called the epicardium, or sometimes it's called the serous pericardium. The serous pericardium, or as it's labeled here, the visceral pericardium, is connective tissue on the outside that basically does the same thing as that internal connective tissue. So it decreases the friction as the heart as a whole is contracting. Just outside that serous pericardium is an area called the pericardial cavity. So to further assist with preventing rug burn on your heart, essentially, we have this fluid-filled space in here, filled with a special kind of fluid called the pericardial fluid. The job of the pericardial fluid is to be an insulating layer or a lubricating layer between that serous pericardium and the fibrous pericardium on the outside. So when we're looking at these layers of the heart, keep in mind that we have multiple. The heart muscle tissue, the myocardium, obviously the most functional one, but we need that endocardium and that epicardium to reduce friction, and the fibrous pericardium is keeping the heart safe. When we look at the heart as a whole, after we've looked at all those layers, let's take a big picture step out. We're going to start with a discussion of the different chambers that we find in the heart. So the first chamber that we see in the heart where blood is going into is something called the right atrium. The right atrium is my top layer of the heart. When blood has circulated through your whole body and it first goes into the heart, this is where it's going. Now, this area is the atrium, this chamber, but our atrium also has a section over here that's called the auricle. The auricle, which literally means ear, is just a special space in that atrium where it has extra space for blood. So the auricle doesn't have muscles to help it contract, but it is an extra space for that blood. When blood leaves the right atrium, it's going into the right ventricle down below it. The right ventricle, when it contracts, is going to pump that blood out of the heart and into the pulmonary artery. Pulmonary artery means the pulmonary means lungs, and an artery means we're taking things away from the heart. So blood goes into the right ventricle from the right atrium, and we squeeze it out into this pulmonary artery to head out to the lungs. Once the lungs have oxygenated that blood's going to come back into the left atrium. The left atrium is where we first start to have oxygen-rich blood because that blood came from the lungs. Just like the right atrium, the left atrium also has an auricle, or it has that extra space for blood to be inside of it. When the atrium contracts, it pushes its blood down into the left ventricle. And when we think about the left ventricle, this is the chamber then that's going to push that blood out to the rest of the body using the aorta. If we look inside the heart, we can see the same chambers that we saw before. I want you to underline, highlight, star oxygen poor and oxygen rich. An absolutely must-know idea when we think about the heart is whether we're talking about a side or a structure that's oxygen poor or oxygen rich. So the first place that blood goes when it gets into the heart is that right side. The right side is where I always see oxygen poor chambers or structures surrounded by oxygen poor blood. So, like we mentioned, first blood comes into that right atrium, the chamber on the top. Then it's going to go into the right ventricle. Both of these structures here on the right side do not have oxygen-rich blood. This is oxygen-poor blood that we're looking at. Like we mentioned before, we send that blood into the thing called the pulmonary trunk. That's going to send it out to the lungs. When we talk about what happens here with the right side of the heart is part of what we call the pulmonary circulation. The pulmonary circulation is the way we connect the blood that comes back from the body's tissues to the lungs. So the right side of the heart, oxygen poor blood, part of the pulmonary circulation, sending blood to the lungs. Once the lungs have worked on it, now we've got oxygen-rich blood. And when we talk about oxygen-rich blood, we're all on the left side now. So just like we saw on the right, first blood goes into the atrium, then it's passed down into the ventricle. The left ventricle is connected to that big blood vessel in your body called the aorta. The aorta is what I use to pump that blood everywhere in the body. So when we talk about the left side of the heart, we would say that the left side of the heart is part of the systemic circulation. We're going to the entire body or the entire body system. A couple quick notes about this internal structure in the heart. We said that we start by sending blood into the atria and we end up sending that blood into the ventricles. Because we have to move the blood from one chamber to another, we need to use specific kinds of muscle tissues to do that. Once you've written the word atria, I want you to underline, highlight, star pectinate muscles. Pectinate muscles are the specific kind of muscles or the arrangement of that cardiac muscle tissue that I see in the atria. By having this arrangement of cardiac muscle tissue, I can make those contractions a lot stronger when the atria needs to push their blood into the ventricles. We use the pectinate muscles during something we call atrial systole. And this word will come back in our next several videos. When we talk about systole, this is contraction. So when the atria are contracting, when they're getting smaller to pump that blood out into the body, this is known as atrial systole. So anytime we hear pectinate muscles, we should automatically think atria, the top chambers of the heart. Anytime we hear trabeculae carneae is something that we only find in the ventricles. The word trabeculae carneae, thank you Latin for that, literally means meaty ridges. So when we talk about what's lining the inside of the ventricles, we call this the meaty ridges or the trabeculae carneae. They're actually serving the exact same function as the pectinate muscles did. So this increases the strength of the muscle contraction inside the ventricles. And the trabeculae carneae also includes some structures that we'll talk more about with the valves called the papillary muscles. So some places in the middle of these meaty ridges will also see big, large extensions that stick out of the ventricle. Those are called the papillary muscles, and they're really important, like I mentioned, for those valves. If I'm contracting the meaty ridges, if I'm contracting the papillary muscles, again, I'm doing systole. Systole, always contraction, but in this case, we're talking about the contraction of the ventricles. So keep track as we're considering our different structures. Pectinate muscles in the atria, trabeculae carneae in the ventricles, both of them used in systole, contraction. One last thing I want to mention with basic anatomy of the heart. The right side of the heart, remember, had the oxygen poor blood. The left side of the heart had the oxygen rich blood. Because we have two different kinds of blood in the heart, we need to divide the left side and the right side from each other to make sure that the oxygen rich blood is always what goes out to the body and the oxygen poor blood is always what goes to the lungs. So to divide up the left and right atrium, we use what's called the interatrial septum. The interatrial septum is this thin structure of cardiac muscle tissue that divides our two atria, or our two receiving chambers, from one another. We also have an interventricular septum. The interventricular septum is between the left and the right ventricle. Remember that these are my chambers that pump blood out of the heart, so we also need to divide those from each other as well. The interventricular septum is a lot larger than the interatrial septum. This has to do with what these two chambers do. When I talk about the atria with their pectinate muscles, all they have to do is push blood down into their next door neighbor chamber. Notice that the muscle layers here in the atria, not very thick. So my interatrial septum doesn't have to be very thick. But when we go down into our ventricles, remember that the ventricles are always pumping blood out of the heart. So the right ventricle pumping blood out to the lungs, the left ventricle pumping blood out to the entire body. By having this thicker interventricular septum, we have more muscle tissue to help us with contracting to allow these chambers to send that blood where it needs to go.